Hi, everybody. I'm Dr. Jaydee Romick. Are you sleeping enough? Welcome back, everybody. I loved Kim Eppen so much on our last episode. I had to bring her back for another one. If you missed our last episode, we talked a lot about chronic disease management and how you have a lot more power over your health than you think. And we love having strategies and practical tips to improve our own wellness, because we just learned in the last episode that 80% of our healthcare is really self-care, and what we're doing on a day-to-day impacts our lives and our health the most. So we got onto a topic last time of the top chronic illnesses. And Kim, welcome back. If you didn't get our last episode, Kim Eppen is here. She's not only a professor, but she's a practicing physical therapist and a pulmonary specialist. She, along a list of things that she's done, but she's a lecturer. She's very passionate about chronic illness, is a very active human. And really, I align with you as a golden retriever as well, because if we don't have purpose, we don't have activity, we're like, we get wound up. So I'm really excited to have you back. And we talked last time, again, about chronic disease management and how we have more power than we think. So the things that we touched on last time are the biggest contributors to our chronic health conditions, cardiovascular disease, diabetes, obesity, cancers, and all of these chronic conditions, can be prevented, or rather managed, with behavior change. And you mentioned sleep last time. And this is something near and dear to my heart, but I also wanted to touch on the fact that our breathing and sleep they intermix so much. You did your dissertation on obstructive sleep apnea. I'd love you to talk a little bit about that and how it ties in with this chronic disease problem we have in America.
Yeah. Well, first off, thanks for inviting me back.
Of course, happy to have you.
And thanks to all those listeners out there if you've tuned back in. Two of the things that really do impact our health and well-being and our risk for managing chronic disease, whether you have a chronic disease already, we don't want you to think it's too late.
Right.
There are things that you can do to help improve your symptoms, or maybe even reverse the process. So, wherever you're at in your health journey, I think people need to recognize that there's maybe something that they can do. And to empower people to have self-efficacy in their own process. You don't have to be a victim of the system, but there are things that you can do.
Absolutely.
And so, that being said, we talked a little bit we mentioned breathing and the importance of sleep with regard to overall health and health resilience. And, I think the two things are, like you mentioned, very interrelated. Sleep is important for just getting regular sleep at night is really important for just our overall general health benefits. It's a time when our body enters a state of restoration. And so what you do during the day, the exposures that you have and so forth, really nighttime is a time to kind of sort of assimilate everything and allow your body a chance to recover and kind of get ready for the next day. And it's good for immune health. There are a lot of just general benefits associated with getting the proper amount of sleep. And you may be wondering, well, how much is the proper amount of sleep?
Yeah.
Well, the proper amount of sleep, what's recommended by, I think, the World Health Organization and the CDC, is that for adults, you should be getting anywhere between 7 and 9 hours of sleep. If you're over 65 years old, I believe it's maybe 7 to 8 hours per night of sleep. And that's solid sleep. Okay, so it's not just a matter of laying in bed at night for a number of hours, but it's a matter of actually getting sleep and going through the REM stages and so forth. It's quality and quantity of sleep that really matter. More is not better.
Yeah.
So don't think that you can deprive yourself during the week, stay up super late, and then all of a sudden it's like, I'm going to catch up on the weekend and sleep until noon and get 12 hours
Binge
of sleep.
sleeping,
Right, exactly. It's the same thing like with exercise.
Yeah.
It's the daily things that matter most. And if you can try to adhere to the recommended behaviors that have been shown to have positive impacts on your health and health resilience, then trying to do those things at least 80% of the time. Yeah, if you stay up late one night, is it gonna kill you? No, probably not. But if you do that repetitively over time, there are negative health implications. And some of those things are, increased risk for cardiovascular disease, obesity. I can't emphasize enough the interrelationship between how your body regulates insulin and uses insulin and weight. And so sometimes for people who may be trying to lose weight, if you're not getting the recommended amount of sleep per night, and you're not getting solid, good sleep per night, that can actually contribute to weight gain. So you may be doing everything. You might be exercising, thinking that you're checking all the boxes of all these things, and you're so frustrated because it may not be translating into the weight loss that you think that it should or could. And it could be that your sleep habits may be sabotaging all of your other efforts.
Yeah.
And so really start to think about, like, what are your ultimate health goals? Once again, kind of circling back to what health looks like for you.
Yeah.
What health means to you, what health feels like to you, and recognizing that sleep is one of the things that goes into that equation, and trying to hit those targets. There's evidence out there that suggests that, or shows that getting less than 5 hours of sleep per night for 7 consecutive nights or more puts you at a 350% increase chance of catching a cold. That's huge, And when I think, like, back when I was a student for many, many, many years, and how I worked 3 jobs through school. I tried to, would get off work late, have to study at night, would get to study, I should say, study at night, and, lay in bed. I'd start studying at 10 o'clock and stay up till 2 or 3 o'clock in the morning, and get up at 7 and, repeat that over and over and over again. It's like, well, how can your brain even function? How can your, like, it puts you at increased risk for, a cold, but also long-term other types of more severe diseases. So
I always got more sick during midterms and final exam weeks.
Well, it's stress, and that's stress management.
Stress, and then also no sleep.
Right. Well, and so when your body is in a state of stress, especially whether it's emotional stress, physical stress, and physical stress can be purposefully induced through physical exercise, because basically what physical exercise is inducing a controlled amount of stress to your body. And your body's going to need recovery from that. And sleep is a time that your body can recover. Emotional stress, stress related to school, any of those things. So restorative sleep is so important. And we know the extremes of what can happen to people who don't get that restorative sleep when we look at some of the diagnoses of conditions that actually are formal disrupted sleep patterns, which one of those is obstructive sleep apnea. As you mentioned, I did do my dissertation work looking at people who had obesity-related obstructive sleep apnea. So we know that some people who develop obstructive sleep apnea have a anatomical predisposition possibly for developing the condition, but it isn't until their body weight reaches a certain level where they can actually become symptomatic.
Yeah.
And then it becomes this vicious cycle of they continue to gain weight, their sleep's disrupted, then they continue to gain more weight, their sleep is disrupted, they're more lethargic, and so forth. And so there's this whole sequelae of things that can happen.
Yeah.
And so really looking at the physical, functional, and psychosocial implications of that particular group of individuals, and how important it is not only to address the sleep portion of the disease by using whatever their doctor recommends, CPAP or BiPAP, or 2 different nighttime ventilation assistive devices that can help to manage the sleep portion of the disease. But until that part is corrected, then you really can't work on a lot of those other health behaviors, because your body is just not in a state, if you will, a hormonal state or physiologic state to really respond to a lot of the other therapies that would be recommended, which would include physical activity,
exercise,
breathing, like even deep breathing exercises, pulmonary health, and nutrition. So I kind of went off on a tangent.
No, it's fine. It just seems like a vicious cycle of things that perpetuate a certain issue that then you try to mitigate with other things that are impacted by the lack of sleep.
Exactly.
Yeah.
And I think that the occurrence of COVID and the breathing related implications that occurred with a lot of people, I mean, it was basically respiratory a virus that affected the respiratory system. So many people that didn't really realize or didn't have breathing conditions before, who had symptoms related to COVID, I think realized the importance of breathing, and then having that taken away from them, or having that compromised for a short period of time, or even some people who are dealing with long-term symptoms, or people who already had some sort of underlying breathing condition who were maybe more susceptible to getting COVID, getting the virus, and having breathing-related symptoms associated with that. The whole awareness of how breath matters and how important breathing is for our overall health really came to the surface. And me as a pulmonary specialist, and I'm also a person who's responsible for, I should say, given the opportunity to develop educational materials for different organizations about breathing and how we as healthcare providers can address some of the breathing deficits that we've seen as a result of COVID, really kept me in tune. And also working with these patients and seeing some of the breathing patterns that were adopted, short, gasping type breaths, guppy breathing almost, shallow rapid breathing, not using your whole lung tissue, and then having to re-educate people about how to breathe again because maybe they've forgotten how to breathe and the virus affected different people in different ways. So once again, it kind of rose to the surface, this importance of breathing and how we breathe matters. It's not just a matter of shallow rapid breathing, but using your diaphragm and doing different breathing type exercises. Breathing is so important because we as human beings are aerobic beings. Our cells, every cell in our body really needs oxygen to survive and be able to perform metabolism and the things that it were designed to do. And so not getting enough oxygen into our system or under breathing can lead to a whole sequelae of health conditions. And learning how to breathe properly and maintaining pulmonary hygiene by doing different things, getting sleep as well, all of that plays into optimizing the way each cell in our body works. And
so, thinking about ways to optimize our breathing or even exercises that could help your patients or regular people. I'm really curious about breath work. What's important? How do you train breathing? And you mentioned in the last episode, and this was kind of what was striking and led me to want to talk about this, is that we even have email apnea. You mentioned sometimes we hold our breath, and I will be 100% guilty of things happen or I get stressed and my breathing is more shallow. Sometimes I think I have the condition of, when you sleep, you actually hold your breath for a time. And I don't know if it's, chronic stress related, but if people are finding themselves pausing and holding their breath, or maybe they're not aware that they're breathing, what are some things that we should be doing to improve or optimize our breathing?
Yeah, that's a really good question. And back to that whole email apnea term, this isn't something that I coined.
This is probably good to clarify. I didn't know where that came from, but that's amazing.
Yeah, no, this is something that I read about and really started thinking about it. But we're finding now that there's health consequences associated with so apnea, just for definition, means cessation of breathing. Okay, so whether it's sleep apnea, whether it happens at night, or email apnea, whatever you want to call it, just holding your breath, apnea means cessation of breathing. And usually it's for hopefully a short period of time, because if it's for a long period of time, that's not good. So we need to breathe to stay alive. But people get so engrossed in what they're doing that they start to underbreathe. And we call that hypoventilation. Hypo meaning under, and ventilation, just a fancy word for breathing, if you will. So you're not really optimizing your lung function and not bringing adequate amounts of oxygen into your system. And so everything just kind of slows down. I kind of call it a semi-hibernation state. You're kind of just slowing your body down.
Yeah, I feel like I do this. I mean, honestly.
So that's good that, we can talk about. So this is really tangible to you and interesting to you. And maybe there are other people out there that do that too. So being aware of it, I think, is the first step towards maybe making a change and realizing, first off, the negative health consequences associated with doing that. Taking breaks from what you're doing, maybe not spending so much time if you're emailing or if you're texting or whatever it is that's triggering that shallow breathing pattern, or those small bouts of apnea. What can you do to break that cycle? The good news is if you get up and move around, or you just take a deep breath, like just remind yourself, or you mentioned before that you wear some sort of fancy watch.
My Apple Watch has a breathe feature.
What does that do?
So if you have an Apple Watch, it will ping you, like it kind of gives you this little haptic tap, and it will say, you need to breathe. I'm like, okay, first, how do you know that I need to breathe? Is this just a function of the watch, or do you know that I'm holding my breath? And then it will actually do a haptic inhale where it kind of does a tap, 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 tap as you're breathing in. And then you're supposed to exhale with it as well. It's kind of awesome. Interesting.
So there are visual cues, like you could look at apps. There's apps on phone. Well, here we're telling you to go back to your phone when you already have email. No, but there are visual aids that you can use. And I use those in a clinical setting. I use those when I teach students also. Like if you're going to try to teach relaxation strategies or somebody how to do diaphragmatic breathing, there are visual aids that you can use, or there are tactile cues, what you're saying. But that really helps to bring more senses into the behavior, to try to help integrate that, and hopefully then that will translate into I guess
kind of like a Pavlovian response.
Yes,
of like
exactly.
Incorporating it more in your day.
Rather than just kind of, just taking a deep breath. But it's a very conscious thing where you're making a mind-body connection between those things. Yoga, Tai Chi, like there are specific disciplines that are out there that people have practiced for years and years and years and years and years.
Yeah.
And maybe you've tried them, maybe you haven't. You, meaning you who are listening, as well as you as an individual.
Yes. I've done them all. It's great.
And,
it's fantastic.
Different things may appeal to different people. So, maybe they don't appeal to you, but other things like your watch and how it gives you that signaling of, okay, I'm going to coordinate my breathing with this signaling so that it becomes a whole mind body type thing.
Yes.
And it actually is a form of meditation. You may, and meditation has been shown, there's plenty of science behind meditation, and people who meditate and practice gratitude on a regular basis tend to be happier people. I know. I
also hear they live longer. I read a study. You guys will have to fact check me in the studio. Like pull this article up. Does meditation help you live longer? I thought it was an average of like 7 years or something. That if people meditate, I mean, I would say taking a break and getting out of your stressful environment because stress can be such a detriment. Chronic stress, I should say, can be such a detriment to our health. But that's another topic.
Yeah. Well, actually, it's really not, because if we're really talking about health,
fair.
What you do on a daily basis matters. So if you've got super high levels of stress, but then I got to meditate for 5 minutes. Here I go. And you do that. And it's a task-oriented behavior. Are you truly meditating? Are you really in the moment? Are you really buying in? So learning how to be consciously engaged in what you're doing, whatever that is, whether it's your physical activity, the relationships that you're in, being part of a podcast, where is your mind as you're doing things, when you're doing your breathing exercises? So if we circle back to kind of how we got off on this, it was, I think we were talking about breathing, email apnea.
Yeah, ways to incorporate more breathing in your day-to-day. And you're talking about these kind of cues.
Right. So that would be one way. There's something called box breathing. This is a book.
Oh, yes.
And
I call it square breathing, but
there you go, box breathing. Right.
Thing.
So I read a book on, I'm just an exercise freak, and I've been involved in teaching exercise classes at health clubs for for years and years and years. And I used to teach this class called Extreme Legs, and it was extreme, and like seriously, like probably one of the hardest workouts that I've ever done, and people who would come to the class. And it's like once you overcame the initial muscle soreness of like getting through, then it's like I'm never going to want to not go to this class again because I never want to have to experience. No, anyhow, so that's a little bit too much overload.
That's okay.
But anyhow, I had a couple guys who were ex-Navy SEALs who came to my class.
Yes.
And so they were telling me that was like similar to some of the training they had done. And one of them, so I was like, oh man, I want to read more about the Navy SEAL training. So I got a book on Navy SEAL training. And one of the things they talked about was breathing. And I was like, breathing? And here I was a pulmonary physical therapist, and I've worked with patients with lung disease. And so I started reading this. And one of the things they talked about was box breathing.
Yes.
And so years later, I kind of looked at that, and they did it for more relaxation training, if you were out in the field and so forth, but it was basically for relaxation training. And box breathing is if you were to actually draw a box and put 4 on each side of that box, each side of the box corresponds with a different part of breathing. So you could, however you want to label it, but breathing in for 4 counts, pausing for 4 counts, exhaling for 4 counts, pausing for 4 counts. And so once again, breathe in, 4 counts, hold 4 counts, breathe out 4 counts, and hold 4 counts.
I feel less stressed already.
Is that amazing?
It's amazing that they can do this in the most extreme scenarios.
It almost immediately causes you to relax. You're focusing on it. And when you're holding your breath, you're not, make sure you're not doing a Valsalva maneuver, but it's just a nice, calm hold of your breath. If you can't hold your breath for 4 counts, like I said, I've worked with pulmonary patients, and for some of them, doing that 4 counts is too long to hold. So what can you do? Maybe breathe in for 4 counts, hold for 2 counts. So maybe it's a rectangle instead of a box. But the concept of doing something where you're completely engaged in that, and you're trying to slow your breathing rate, and if possible, breathing through your nose, because there are some benefits associated with nose breathing as compared to mouth breathing. We'll talk about that in a minute. But I did want to mention this book that I attended and spoke at a conference a couple years ago, and one of the physicians who spoke at the conference was talking basically about the healthcare system as well. He was at a point in his career, and he was the head of a cancer center, and I'm not going to mention names or anything like that, but he had been the head of a cancer center at a local hospital in our region, and he started to question, like, what am I doing?
Yeah.
So many people I've worked with, we're treating them with medicine, and what, like, it's not a long-term fix. Like what else can we be doing to look at a whole person? And so he really started looking at functional medicine training and exploring other things. And this was one of the books that he mentioned. Amazing. And my thoughts were really aligned with him in kind of like just questioning, like, what does the healthcare system look like now? Why has it evolved into the way that it has? And are there other things that we can be doing and that individuals can be doing? I think about, what is the best health insurance that we can have? Your health. So many people talk about, well, my premium is so high, and if I'm paying this much for my health insurance, I should use it. I deserve this. It's like, well, sure, you can deserve it, but that means you have to be sick. And a lot, you can get your well checks each year, but there's sometimes when you do have to go to the doctor. But like, if you can avoid going, the greatest health insurance is your health. If health matters to you. Anyhow, with that being said, this was one of the books that doctor had read, and so I decided to get it, and I sat down and I read it, and it talks about breathing, and I learned so much. But
that's amazing.
Back to that whole Navy SEAL thing, talks about box breathing and this. There's a whole bunch of breathing strategies that this author talks about to essentially bring our attention to the fact that so many of us are not breathing properly. And a lot of it is because of our behaviors. Sitting at computers, mouth breathing, letting gravity pull in our mouth, and not nose breathing, and the anatomical changes that actually occur with mouth breathing as compared to nose breathing. And so some of the benefits associated with nose breathing are it actually can increase the tone. You're having to overcome some of the resistance of your nasal passages to breathe. Also, supposedly, each nostril corresponds to a different part of your nervous system. Your right nostril is supposedly your gas pedal, so it can actually increase your blood pressure and heart rate. It's linked more to your sympathetic nervous system, and your left nostril is more linked to your parasympathetic nervous system, which basically is your brake pedal, which actually slows your breathing and can be calming. So
should I plug one side when I'm breathing?
That's really, so there are some yoga breathing practices where they actually tell you to do alternate nasal breathing, and some of those things are in this book. And you can totally geek out to all these different breathing strategies.
That's amazing.
If we kind of circle back to what your original question was,
let's tell people what the book is.
It's called Breath, and it's by James Nestor, and it says The New Science and Art, or the New Science of a Lost Art.
I love that. So if you're driving or you're listening to this and you can't see the visual, but it's a bright yellow book, and it's just type in Breath, maybe on Amazon. It's a New York Times bestseller. It's amazing. I'm very fascinated. Continue.
But so you asked about, are there different breathing strategies that people could do to optimize their breathing?
Now I'm going to plug one nose and the other.
Well, if you're high strung, plug your right one. So no. So breathing through your nose does matter. It makes a difference. And that's under, practicing these things under resting condition, doing diaphragmatic breathing where you can actually sit, put your hand on your stomach and just gently kind of feel for your stomach to come out as you breathe in, trying to breathe deeply. And then as you exhale, feeling your abdomen return back to its baseline position. If you're new at doing this, or if you're having difficulty doing this and you can tolerate laying down on your back on the floor, that's probably anatomically the best way to learn how to do this, and then move towards a sitting position, and then you can actually transfer it over into a standing position. And that's called diaphragmatic breathing. But there are a lot of other breathing, box breathing, the 4-4-4 was one method. There are so many other types of breathing strategies out there that go along with meditation to calm the body, calm the breathing, but also, and calm, you can actually impact your heart rate. For those of you that have fancy watches out there, you can slow your breathing rate and watch your heart rate, or, check your pulse and see how you can actually slow your heart rate down and decrease your blood pressure if you're taking your blood pressure just by taking some deep breaths in.
Amazing.
So back to the whole email apnea thing. If you have to email for, let's say, a period of time, and a lot of our jobs require us to do that, or if you're sitting it doesn't just have to be email, but if you're sitting for a long period of time, once again, take frequent breaks. Physical activity stimulates breathing. It stimulates your breathing drive. So that in and of itself, getting up and moving actually causes you to breathe deeper and faster. And
so is this going to be part of your tips today? Sorry, this is actually amazing. So this is a perfect,
that can be a tip right there, is to take breaks.
Great.
Get up and move. And physical activity, movement can actually improve your breathing physiology by forcing you to breathe deeper and faster, or just taking deep breaths, or by picking a breathing strategy and trying to do that. But
I love that.
Trying to minimize prolonged periods of time where you may be actually experiencing those apneic episodes or near apneic episodes of just breathing cessation or slowing your breathing, your depth of breathing.
Yeah. Maybe even convincing yourself, or not convincing, but training yourself when you're emailing to actually work on breathing deeper.
Absolutely.
And make that your Pavlovian response of, I'm emailing now, I'm working on my breathing.
Right.
It's good for you.
I mean, maybe that could be like
Anyway.
Yeah, different kind of exercise. Yeah, for sure. And then I don't know how much more we wanted to talk about sleep and sleep hygiene.
Yeah.
You know, we talked about the importance of getting a certain amount of a sleep, and it's what you do on a daily basis that matters most. So it's, you know, one of my brothers is an ER doc, and the shifts that he works, like it's ridiculous. 12-hour shifts. He might work 3 nights in a row, have 1 day off, and then work 3 days.
Yeah.
And to see him and his circadian rhythm and how that, you know, it just messes you up.
Yeah.
But he does it, you know, he's learned to do that. It's become, you know, people who are factory workers or who work night shifts.
Night shifts or shift work is tough.
And so there's a reason why we have daylight and we have nighttime, and we have these natural, what's called circadian rhythms, where our body just naturally is in a state of kind of having a certain flow, if you will.
Yeah.
And so nighttime, when the sun goes down and it becomes dark, you know, that's when our bodies start to release melatonin, and it's time for bedtime. And so getting rid of those other lights. You mentioned to me the other day that you take your phone out of your bedroom. What are some tips that you have?
So sleep hygiene, I nerded out on this a while ago because, you know, coming out of grad school and being in school for so long, you do develop these really poor sleep habits and you over-caffeinate. So those are probably 2 of my biggest tips is, you know, obviously developing a good sleep hygiene routine where you keep your phone out of your bedroom. You're not exposing yourself to blue light a few hours before bedtime. There have even been some studies, and, you know, I won't quote the studies, but I will kind of refer people to Dr. Andrew Huberman at Stanford and Dr. Matthew Walker. And I don't know where he is, but he's a sleep researcher. Specifically, Matthew Walker is more of a neuroscience guy, but talking about reducing blue light exposure before bedtime is critical. So whether you're falling asleep to a TV, falling asleep with your phone, or just having electronics on in your room. There are some folks that completely turn off their power grid at night. I don't know that that's feasible for everybody, or, you know, if the data really support like no electricity, but I think the closer to nature we are, likely the more the more our body responds to that. But I would also say, don't over-caffeinate. So if you drink a cup or 2 of coffee in the morning, not drinking coffee into the afternoon if it affects you that way. Some people don't really have a big response to caffeine or a big energy response, but excessive energy drinks and caffeine intake is just, it's really sugar can be really damaging to your circadian rhythm and your sleep cycles. Yeah. One empowering one, instead of, you know, take away all these things, is actually getting sunlight in your eyes within like 20 to 30 minutes of waking.
Oh gosh.
Which is hard when we live in the Pacific Northwest or you're somewhere where it's dark in the morning, but getting lights on in your house early on apparently is great when it's dark, but when you have sun exposure, get sun on your face for 20 to 30 minutes. That stimulates your pineal gland to help regulate your hormones and get you on a proper circadian rhythm. So,
and vitamin D,
which
has been linked
so important,
right, for immune health and just overall
cancers.
Health. So,
like I think I shouldn't quote the study because I will botch it, but that vitamin D is linked to increased risk for cancers and certain issues that we haven't quite figured out just yet, but vitamin D is huge.
Yeah.
So, I love that. I mean, I don't know what other top tips you have for sleep hygiene.
You know, I do want to say though, that if you have we're talking about sleep tips for people who don't have diagnosed breathing conditions.
Yes.
And so I just, as a disclaimer, just want to say that if you've been diagnosed with obstructive sleep apnea, or if you suspect that you have obstructive sleep apnea, if you snore a lot and somebody's heard you snore and you're not breathing at night, recognize that there can be a sequelae of other health conditions, negative health conditions that can occur if that's not evaluated, and it should be evaluated in a sleep lab or by a doctor, having a formal sleep studied, and then trying to get proper treatment for that to manage the sleep portion of your condition to mitigate other health conditions. So I just wanted to say that. But for just general sleep benefits and breathing benefits, just once again, I can't emphasize enough, it's 80% of healthcare is self-care. Yeah. And what you do on a daily basis has the greatest impact on your health and health resilience. And when we say health resilience, that's your ability to deal with challenging circumstances that can impact your health. It's important for healing. So getting the recommended amount of sleep per night, practicing good sleep hygiene, breathing is so important for your health, and doing it the proper way. And so, there are formal classes, yoga. We can't not mention yoga, Tai Chi, and other, even if you play a wind instrument, like something like that, or you sing, like all of that can just drive your breathing process and be good for pulmonary health too. So, so those are just some tangible things and exercise drives the breathing response as well too. So, and can help with sleep as well too. So
yes, I forgot to mention that, but exercise helps induce better sleep as well. So, and then also talking to a therapist if you can't get some sleep and you have ruminating thoughts and maybe some mental health components too. I remember there were times where I would ruminate on things and it would keep me awake, or I'd wake up in the middle of the night and then I can't go back to sleep because I've got a to-do list running in my head. So that can be a topic for another day as well. But getting some of those thoughts out on paper or with a therapist, I think would be great as well.
The good thing about to-do lists are they're going to be there when you wake up.
Exactly.
So if you can just like put those aside and maybe before you go to sleep, I mean, one of the best tips I have is to take some deep breaths and practice gratitude.
I love that.
Try to come up with 3 things that you're grateful for. Yeah. And if you can't, then that is a problem. Yeah. I mean, that really does show that, gosh, where is my focus? Am I choosing joy? Am I a victim of whatever my circumstances are right now? So all of it ties into your overall health and well-being. So once again, circling back to you may have more control or more power over your health than you think or
Yeah.
Like,
it's true.
Yep. Choose what health, feels like to you or what you want your health to be like and try to take steps to move in that direction.
Yeah. Wow, Kim, this has been super special. We got into topics I didn't think we'd even get into today. And I'm really hoping that this hits the right person. I think folks are listening to this that are meant to right now. And so I really appreciate you sharing. Thank you so much.
Thanks for having me.
Can't wait to have you back.
This video podcast is a production of George Fox Digital. To find more material like this, you can subscribe to George Fox Talks on YouTube, Apple Podcasts, Spotify, or wherever else you listen to podcasts. Our team really appreciates your feedback in the form of likes, comments, and reviews, and we'd really love to hear what you think. To sign up for our weekly email list and to keep up to date with the latest episodes and publications, you can check us out on the web at georgefox.edu/talks. Thank you for listening, and we'll see you in the next episode.